Hi, welcome back. Hi, Mila. Welcome.
Hello. So
Great to
nice
have
to
you
be here.
here. So nice to
Great.
see you again. I mean, we often see each other in the community,
Mhm.
but today we are here to talk about the supervision calls that you host in the community, or you host many of them, and you're in charge of our supervision topic in the community. How, why supervision? Why is that a topic that you're so interested in?
Sonia, I'm so happy to be here with you today and to talk a little bit about this wonderful place to share experience and ask each other questions. I think that great part of the community is being able to connect with colleagues.
Mhm.
So in the beginning, I had the feeling that the most important question that the colleagues come for in the lead community is how to start a business. And this is an important question. And there is nowhere else or very few other places where a person of our yeah of our line of business can learn these things. So supervision was a little bit like an experiment, just to see. We have all these wonderful colleagues here. Can we also give each other advice on more day-to-day work therapy related questions? And I can't believe that this became so mm, important and essential part of our experience in the lead community.
And it really has. We have 95, 96 members. I just checked before our call. And we have many supervision groups. All these members can attend a lot of different supervision calls. And I think as a therapist, no matter what your background is, supervision is always an important part of your work, right? We all need supervision. Sometimes it's one-on-one supervision, but I'm personally a huge fan of group supervision. But I've also been in past jobs and work situations in supervision groups that didn't feel that welcoming, or where it felt a bit scary, or like a test to present a case, or where I would be judged, or maybe I didn't get that many new ideas. And I think that's something that we definitely have covered in the community. We are really good at having new ideas and different ideas. And that's especially because you created a space that is really for everyone. And we have members with so many different backgrounds. So can you tell us about your background and what you like about interacting with colleagues, maybe from different backgrounds in supervision groups as well?
Oh, yes, of course. My background is strictly psychoanalytic, French psychoanalysis, Lacan, PhD in psychoanalysis, cultural philosophy. So all the very analytical, strictly typical analytical training. And you know how we psychotherapists get really attached to what we dedicated so much time on. We dedicate so much time on getting ourselves trained in our line of work, and also our teachers are very passionate about showing us CBT, ACT, psychoanalysis. They're very passionate about Lacan or about Freud or about new neuropsychoanalytic techniques that I'm also training in. And somehow along the way, we lose the opportunity to meet amazing colleagues who work in a very, very different way.
Mhm.
And it's so rich to learn from each other, even if your specific work is very different and you are not going to implement exactly the same technique as I do, just sharing an experience with somebody who does it in a different way and
Mhm.
in a absolutely non-judgmental environment is amazingly rich. And I don't know where else in the world of therapy this kind of communication is possible.
Yeah, I often join your supervision calls, and I can share this from my own experience. I love the mix of, well, I'm trained in CBT originally, and I work with a lot of ACT therapy now. And sometimes, Mila, when you present a case, you will be like, I would like to hear from the CBT therapist. What would you do? Because I feel like this client needs something else right now. Or maybe, is there a different way of looking at this? And on the other hand, when I present something, I don't need someone to tell me the things I already am doing necessarily. I'm much more interested in new perspectives or other ideas or different interpretations or people noticing things that I kind of just mentioned but didn't really put that much focus on, because to me it didn't seem that important. And I was joining yesterday a supervision group. We also have supervision groups, so most of them are in English, but we also have many colleagues who speak Spanish and many colleagues who speak German. So some of our members created supervision groups in those languages. And I attended yesterday a Spanish supervision call, just to be honest, just to practice my Spanish and to listen. And it was really fun. But it was also interesting, that idea of with the different cultural backgrounds, especially in like that Spanish context, for example, where it's the different modalities and the different trainings, but then you add that layer of, well, Argentina is very different from Spain or, Mexico. And then if we do this in English and we add even more cultures and more backgrounds, and CBT is done differently in different parts of the world when you look at how it's really implemented, or the type of ACT training we did is slightly different. And yeah, I love that. I love having that, yeah,
I think
diversity.
maybe this is why we don't have yet internationally standard of care for psychotherapy, and it is so difficult to move as a psychotherapist from one country and one system to another. I noticed that it is not so hard for medical doctors, so I've always wondered why, but cultures are different in every place in the world. It makes sense to learn something a little bit differently. Maybe if the theory and the neuroscience is the same because we are the same species, culturally, we are still a little bit different. And what is typical in one is not good practice in another and can be taken the wrong way. But we work internationally, so we need the international touch in our supervision communication, and it goes beyond the training that we get in school.
And sometimes we also use that space just for simple questions, right? So most of the time supervision is you present a case and we discuss that case and we brainstorm ideas. But it can also just be a question: how do you approach this topic? Or have you had this situation, especially when we come into some kind of dilemma situation, whether it's an ethical dilemma, or especially when working across borders and countries, and regulations can be really complicated to navigate. And so how do you do that? How do you handle it when what's ethically correct is not the same as what's legally correct? And having a safe space to discuss how to handle those things and who to turn to, and how to communicate that to our clients as well, or to people who want to work with us when we have to tell them no, like all these different things. But my personally favorite thing is a very small one, but so, so useful. So I mostly work with Germans who live all over the world. And often they have colleagues or a partner or someone from that country or from a different
Yeah.
country. And sometimes they tell me a story and I'm like, well, I don't know if that's a cultural thing or if that's just that person. But luckily, I have lots of colleagues from all over the world that I can ask. Tell me, is this normal in that culture? Is that kind of a typical cultural behavior, or is that person maybe having an individual issue of some kind? Because how we react to it and how our clients can handle these things will be completely different, right? Whether it's more cultural thing, or what kind of understanding do they need to bring to the table? And having those colleagues to ask those questions to is so helpful.
It's definitely the place, because people are always a little bit confused. There is always something left missing and lost in translation in a way. And so, uh, it is difficult as it is to navigate international relationships, and the therapist has to deal with it just as much as the person in the international relation. And this is not in the textbooks, this is not in the training. Nobody went to school studying about the specifics about how people from Argentina communicate with people from Germany, and we might you can come to supervision session in lit and have a colleague who also has a couple from Argentina, Germany, and another one who sees a German client who's married to Argentinian person. So it's unique experience, and I want to go back to the experience of the supervision. Besides the benefits about how international it is, another added value is how friendly it is. Sometimes we as therapists, because it is so important part of our training and our licensing, supervision has become a little bit like an exam. And it's nothing like that. This is a friendly conversation between people. We are all in this together. We are all learning how to be citizens of the world. And we are trying our best. Nobody is in the position of power, deciding whose work is good, whose work is bad. We are here to help.
And we have therapists who have been therapists for 30 years, and we have some who just started last year and who are just finishing their training, and we're all the same. Like, obviously experience helps, but we all struggle and we all have issues. But I think this is actually a bigger topic than just the supervision, because what people who are watching who maybe aren't therapists or not from a psychology background or whatever it is in your country, they might not know that therapist groups can be really mean. I think people think we are nice people.
people don't know that.
Some of the nastiest Facebook groups I've ever been in were therapist Facebook groups. And when you do something that's a little bit outside of the traditional, whether it's because you're working online in a place where it's not common to do that, or whether you work with people in a different country or you've moved country or whatever it is, we are doing something that is usually outside of the established kind of thing. And that meets a lot of criticism when you talk to more traditional colleagues. And in general, those groups can be really, you're not allowed to do that, but why are you doing this? And this is mean, and I'm going to report you to the licensing board. And it's such a tunnel kind of vision, like my way of doing is the only correct way. And then you're like, but just because it's like that in your country doesn't mean it's like this in the country I'm licensed in. And let's talk about how we navigate these international issues. And having a space where that is so different has been so amazing. Like, I mean, I co-founded the community, so I'm very biased, but I also really love being a member of this community, because it is that space where people can openly share struggles and things that they're questioning and doubts they have. And no one is going to be like, well, you shouldn't be thinking like that, and you shouldn't be, you shouldn't be a therapist. They will really be supportive and share their struggles and similar moments and experiences. And that's also something we see a lot in those supervision calls where, we all struggle,
And think about it. You are a founder, so you have all the information. Did anyone ever, for all these years, of all the hundreds of people who've been in the community and still are, did anyone come to complain that they went to supervision, it was horrible, felt very judged, and won't do it again?
No, I don't believe that has ever happened. I don't think it will ever happen. I think still it can be a scary thing when
Mhm,
when you don't really know what to expect. So one thing that we encourage people is to join and just listen. You don't have to
mhm,
actively participate. You can just listen and witness and see how it is. And it's actually the same for other events as well.
mhm.
You don't have to play an active role. We will ask you if you have anything to share or if you would like to add or if you have any thoughts. But some members just want to listen and see how it is first and experience it. And then they will present a case maybe in a few weeks or one of the next times they can join. And I have to say, I profit at least as much, maybe even more from supervision when I'm not the one presenting a case. Because hearing other people's struggles and recognizing myself in them and
Mhm.
noticing things that also apply to some of my clients. We had that in a recent supervision that we were both in, where someone was presenting a situation and it made me think of one of my clients that I hadn't considered bringing to supervision because I didn't feel like I was struggling with that client, but it gave me a new idea
Mhm.
and a new perspective. And that was so enriching.
Yes, I was thinking about that. Nothing is compulsory, nothing is required to join a supervision. Just recently had a supervision with people who are just beginning, and
Mhm.
they had amazing insights. One or two clients on their case work still in training, amazing insights. You
Mhm.
can't because they're fresh out of
Yeah.
university. So
They have all
people,
the new knowledge.
yes,
They're
all
really
the
well
new
trained.
knowledge,
Yeah.
well trained, very fresh on their exams, and just bring new ideas. Uh, Sometimes you don't even think about a case that you have, as you said, and then, oh, I can try this with this or that patient. You don't even have to share it with the others.
Mhm.
Uh, Maybe it's time to say how it works. It's
Yes.
yeah, very well. It is very simple. One speaks about a case or about a question or just about a personal struggle that they're going through. It if it's therapy related and their work related. So for the business struggles, there is a space in lit
Mhm.
in on the hot seat, and the supervision is for every struggle related to how to position myself in the world of therapy as a person, as a therapist, with this person as a client or that person as a client. Um, there is no need to bring a case like very well presented and gather all the information. Sometimes people come and on top of their mind, this case I heard about right now reminds me of a case
Mhm.
of my own. Do we have time to speak about it? We try to speak about two cases for one supervision meeting, but sometimes we only see one because it's so
Mhm.
rich and interesting, and so many things are going on, and we have so many ideas. In other cases, people have 4 or 5 small questions, and it's different every time. But you're not supposed to present in a very prepared academic way. Just
Mhm.
say what you think about your struggle and where what's difficult for you.
And what questions do you have for the
Yeah.
group, or how can the group help you? And I often find the question of why are you bringing this case?
Mhm,
What is it that you are actually struggling with, you as the therapist? What is it that this is doing to you, that you're feeling, that you're noticing, or where? And often we feel stuck because the client is stuck, or because it's doing something, the transference and counter-transference, and
mhm,
I'm not the analyst here, but
mhm,
all these things. And it can be really helpful just to bring a case even when you don't really know why you're bringing it. I think that's
mhm,
my most common thing that happens to me, is that I don't necessarily bring a case because I know, I'm actively
Mhm.
struggling with someone. Sometimes this happens, but it's more like, I don't know why, but I feel like I should talk about this case and maybe the different perspectives and the different questions. And then there will always be a colleague who asks me a question, and I'm like, I think that's why I brought the case. And that question can come from wherever, just brainstorming and noticing what, when I'm presenting the case, what people are noticing or what they're hearing or what their questions they might have. And so it's quite improvised in some way. But it's such a safe space that you feel like you can do that, even if you're not prepared, or, not that you have to prepare, but like it is, you can go with the flow and see what happens, and it will always lead somewhere really, really rich and, yeah, rewarding, I find, for my work. I find joining the supervision calls has improved my work as a therapist so much, and it keeps doing that. Yeah.
Mine too. I felt like a crazy person working online way before COVID. Nobody was doing the same. My supervisors were extremely friendly and nice people, but it still felt like I'm going there. You have 40 years of experience. Um, I need to present, and this is more of a friendly conversation between peers. And we don't know if maybe someone of us is a famous psychologist in their country and have a waiting list of 100 people. Another one is just now starting, but you can't tell if they don't tell you because they look so wise and so experienced. Sometimes people give you this vibe, some old
Mhm.
souls.
Mhm.
And it doesn't matter. It truly doesn't matter what you bring. Just bring yourself. And I wouldn't even push people to speak. I wouldn't ask in the end of one case presentation, oh, you spoke and you spoke, and what do you think? You didn't say anything. Uh, Others would moderate it in a way to make sure everybody said something.
Mhm.
Um, uh, it depends, but nobody puts anyone on a spot. Nobody examines. So, uh,
And there will be, some of
mhm,
us have been doing this for a while. So the two of
mhm,
us and some other members, we often go to, or are often together in supervision groups. So um, those who join maybe for the first time will also notice some ways that we interact, where,
mhm,
if you present a case, I might tell you something in a different way than I would to someone that I'm just meeting and who's presenting for the first time, because I know
mhm,
you know how I mean it if I say something, or because we have that kind of supervision work relationship
mhm.
as well. But I also love that mix of, there are some people that are often in the supervision calls, and then there are new people, and then it changes over time, and there's, like, it's an open group, it's not a closed group, it's not always the same people. And I really like that because it brings so many different, it's that mix of stability and ongoing support from the same people, with some new and rotating people. And some people can join every month, every week. Like, we have different supervision groups that happen, most of them happen once a month, but so we have almost a supervision group a week, I think, at the moment. We also have, just to, maybe we should talk about that briefly, about the different types of groups we have, just as a summary, because we have a lot of different
Mhm.
groups and they're all open to anyone, but maybe you can highlight the different groups that we have.
There is something for everyone.
Mhm.
Um, and
And if it's not there yet, you can
yeah,
create it, because
yes,
inside the
yeah,
lit
it's
community,
open.
anyone can create events
Yeah,
and suggest events as well.
yeah, I have a little bit the initiative of making sure that supervision is happening and that there is at least a couple of supervisions every month, but it is open for everyone to create their own space if there is a different supervision that they want for, and invite the members who are at the same page like them. For example, we just recently started a couples therapy supervision, um, specific for couples therapy. There are a couple of supervisions in German and in Spanish language, just to mix up the languages and not speak English all the time. And as you said, you have practiced your Spanish sometimes in our supervision calls, and it's so nice to. You don't do therapy in Spanish, do
No,
you? No.
no.
So eh, so it is
I'm
a
still
nice way
learning,
to mix it
and
up.
I don't think I will reach that level anytime
Mhm.
soon. But it is really nice when you're learning a language to also look at that professional language is really interesting. Yeah.
And there is one that is absolutely open, general for everyone in English. Anything you can bring there. And one of the first meetings for supervision was generated by me in a more psychodynamic, psychoanalytic vibe. But at this point, really everybody is welcome. We don't use a lot of jargon. We tend to get together with a couple of old members who are more psychoanalytically trained and inclined, but everybody is welcome if we won't throw a bunch of jargon
And
there.
I love joining as someone who is definitely not from that background because it's interesting to learn that jargon. And I actually like it when you use it a bit because while it's not super intense, you still definitely have that kind of like, using words that I'm not so familiar with or concepts, and then learning more about those and different ways of looking at issues and questions we have, to me is so enriching and wonderful because, yes, as we said at the beginning, we're very much used as therapists to be in our little professional tunnel of this is the only way of doing it. And the reality is once people are out of school, they start mixing modalities in many ways. But we're not often
And they're
trained and
afraid to say.
qualified, and they're afraid to say it. So
Say it.
actually
Yes.
having spaces where we can really also learn about those and not just, do it somehow, but have a bit of, you're also someone who is really into research, and that is not that common in your field. So you bridge that gap, and you are part of the two worlds of you really like science, but you're also from a psychoanalysis background. How is that even possible? As a CBT trained therapist, I thought those people do not exist.
Oh, we are many. Actually, there is a whole neuropsychoanalytic community, which I'm a member of. But many people try to connect what we know now of neuroscience and what we have always intuitively known in psychoanalysis, a little bit the dynamics that are under in the language, in the back of your mind when you make a joke. And these are very subtle movements of the mind that are still difficult to study scientifically, but we try to correct for anything that's not backed up by science, and also bring to science interesting observations about transference.
And we have very similar, in the end, we all deal with similar issues, and humans, right? We all work with human beings, and they all struggle with the same kind of handful of issues. If we're being honest, it all comes down to some of the most basic issues that people struggle with, and then it can show up in different ways. But it's also interesting to learn from colleagues when they have a training. I was thinking about a colleague who was talking about schema therapy recently in a supervision call, and an exercise or concept from schema therapy. And I only, like in my training, I did one weekend on schema therapy. I'm not trained in that modality, but I always found it interesting, but a lot of it is very similar to other approaches as well. There is an overlap. It's not like every school of therapy has completely reinvented the world. So I think we have a lot more similarities than we have differences. But we need to be in these shared spaces to notice that, and to notice that it's okay to mix and to be more integrative, and to understand why we're doing it and how we're doing it, and to have those spaces to discuss it.
Yeah, know what you're doing a little bit better, because even when you are in your line of work, and I don't blame the colleagues who are very rigid and this is the way to do it. It's a very hard work. We need to just grab onto something to believe that we are doing the right thing. But it is hard to support a person through the hardest moments of their life. And something must hold us in a way. And I think that the best about the supervision, and especially when it is so integrative of different ways of doing therapy, is that what holds us is the community, not the method, not the strict following of the method letter by letter, but the support you get from 5, 6, 10 more brains who are trained to do what you're doing.
And I mean, it's the same in our work, right? We know that the best predictor is the therapeutic relationship, and it's not the specific training. And that's what we find in community, and we find it in supervision, and that's what we're here to talk about today. But we also, you have over the time created special events, especially around that, like support in difficult times. The world has gone through a lot of rough times recently, and we work with a lot of people struggling right now, but we're also struggling because we're going to similar world events and handling similar things. And the first time was during the pandemic, when we launched the community just before the pandemic, and you started a survival supervision, we called it at the time, to just discuss how we are affected and how our clients are affected, but also how we handle being in that same world as our clients, which is not always what happens in our work, right? So often we support someone who struggles with something that we're not actively struggling with. But when it's something global, we're all in it. So where do we talk about that? And where do we get the support? And our supervision groups have definitely been a great space for that.
Every now and then, yes, we meet to discuss the global situations, everything horrible that is going on right now and affects us. Is the place to get the emotional support. So it is the survival supervision is a little bit different. It's just tell what you hate about the world, and we are here to support you, not to give you advice. Well, in the usual supervision, we'll support you and give some advice, but here sometimes it will be all about, well, I feel the same way, or I feel differently, and this is why. Place for the everyday struggle. Because sometimes we have to just bury our own pain to help other people go through theirs, and we don't have to be in therapy all the time or in analysis. It's good to go through some years, but in very specific situation, just sharing with a colleague is good enough.
Sometimes all we need is a safe space to say how bad things are right now. Sometimes we need more, obviously, but sometimes that is already what we need. And so, yes, we have all of that in the lit community. And so join us in our supervision calls. If you have any questions about supervision, or you're thinking about starting a group, you can reach out to Mila. She's the one in charge of all the supervision groups, or helping people set it up if they have questions. And if you're seeing this and you're not a member of our community yet, join us when we open the doors next time. We don't bite. We are quite nice, but you will get a lot out of it, not just business support, but really also that professional support. And I think value-wise, that's amazing because in most countries, supervision is pretty expensive. Obviously, depends on where you live, but our membership price is basically based on that hourly fee of a therapy session, right? So, and supervision is something we all need and need quite frequently. So that's something you will get within your membership.
I can't wait to meet everyone who's joining now, everybody who is in the community, but has been hesitant about starting their supervision journey. Yeah, we don't bite. It's wonderful. The support is amazing. I love everyone. They just, yeah,
Yeah, I can't wait to meet you and
great
our new
people.
members and anyone else who's joining us. Yeah, see you soon.